Hi, it's Dr. David Green, CEO of the Arizona Pain Network. Today's topic is a procedure called a radiofrequency ablation. There's also some other terms that are used to describe it. Medial branch thermocoagulation, radiofrequency lesioning. All these terms mean the same thing, but the most common one is radiofrequency ablation. Now, what is it? Well, it doesn't have anything to do with radio, okay? No FM or any of that. But what it does is for someone who has chronic pain either in the back or the neck, or also in the SI joints, and now there's other areas like pelvis, abdomen, things like that. Even up in the neck for some headaches, you can do a radiofrequency ablation of nerves. And these are sensory nerves. These are not nerves that have a motor function. Okay, so it's not a nerve root like these yellow things here. It doesn't involve that at all. That would be bad. Okay, what it does is, for instance, these are facet joints up and down the sides of both sides of the spine. In the lumbar, you also have them up in the cervical. All right, what happens is there's little tiny nerves called medial branches that bring sensation to these joints. And what a radiofrequency ablation does is it deadens those nerve endings, and it can relieve pain for a long time. We'll talk about the outcomes in a second. So who's indicated for a radiofrequency ablation? Well, if you have chronic back pain due to arthritis, it's a great indication. As we age, these joints have cartilage just like your hip or your knee. They can get arthritic and cause pain. Okay, so if you have a procedure before the radiofrequency ablation called a medial branch block, that's usually required. The needle goes in the same place around the facet joint. The pain doctor will inject some numbing medicine. That usually provides relief for a few weeks to a few months. And then, if that wears off, the insurance company will approve a radiofrequency ablation. Now, what a radiofrequency ablation does is it can provide pain relief for, on average, 15 months, whether it's in the neck or the low back. That's a huge amount of time for a pain management procedure. Pretty long term. They also did a study looking at when the pain relief wears off, like if these little nerve endings grow back, can it be done again? Absolutely. The outcomes were the same. It was over between 75 and 85% got amazing pain relief from the procedure. All right. Now there's been some new studies also looking at the procedure for the SI joints. There's these, instead of medial branches, you have these lateral branches coming in and supplying sensation to the joint. That gives, I think, half of patients in that study got at least 6 months of great pain relief. And now they're looking at it for the occipital branches that cause occipital neuralgia. It can be effective there. It can also be effective for chronic pelvic pain, chronic abdominal pain. The indications keep growing. Visit us online today at ArizonaPainNetwork.com. You can see a listing of the locations where we have physicians, the insurances that we take, the phone number, as well as additional educational information with a lot of videos and articles. Thank you very much for watching.